District number 5. It's great to see so many people on the meeting right now. We have 17 people. I have 2 of my commissioners online with us, and then my 3rd commissioner, Pat Harper, is on the phone with me. He's having some technical difficulties at his house, so as soon as he's able to figure those out during this meeting, he'll join us up on the screen. We are recording this meeting. It's also being projected to the big screen in our training room today, and this will be going on YouTube after this sometime, hopefully before the end of the month, before the next meeting is my goal. Okay, so I'd like to have everybody introduce themselves if they could for the record. You'll have to individually unmute yourself to do that. So Patty, we'll start with you.
Good afternoon, everyone. My name is Patty Markell, and I'm the Finance Manager with Fire District 5.
Okay, I'm the Fire Chief, Point Roberts Fire District 5. Yolanda.
I'm Yolanda Default, and just a resident here of Point Roberts.
Great, thank you for joining our meeting today. Linda.
Of course.
I'm Linda Hughes. I'm the Secretary of Whatcom County Fire District 5. I'll be taking minutes.
Okay, Ray.
I'm Ray Newman. I'm the Fire District 5 Commissioner.
Thank you, Ray. I'm not sure who's the 919-360-7066. Go ahead and unmute.
That's Sarah Armo. I'm involved with the prep team with the Virginia and Kelly.
Great. Can you say your name one more time for us, please?
Sarah Armo, O-G-G-E-L.
Thank you so much. Okay, Ricardo. Ricardo and Gina.
Thank you very much. It's Gina Fiorillo and Richard Foreman from Vancouver, Canada. Happy to be with all of you. Thank you.
Thank you for joining the meeting. Jackie Kinsey.
Hi, Christopher. Good to see you.
Good to see you too.
I'm Jackie Kinsey. I've been a Point Roberts resident for 25 years. Previously, prior to my new retirement, I was the marina manager
Okay, thank
here
you.
at Point Roberts.
Great. Heather Lindquist.
Hi everybody, I'm Heather Lindquist. I'm kind of new here. I've been here for now 3 years, and so I'm just kind of a newbie here to Point Roberts, and yeah, so I thought I'd join in on the call.
Thank you so much for being here. Pat Grubb.
Thank you.
Everybody knows Pat. He runs the newspaper. So he's the news person on the meeting today. Raul. If Raul's going to join.
Hello, can you hear me?
Yep, go ahead, Raul.
It's Raul. Just going to join for a few minutes. I'm volunteer support in Point Roberts. Can you watch?
Okay, great. Spencer Kite.
Hi, everybody. My name is Spencer Kite. I'm a probationary firefighter down in Point Roberts. Thanks, Robert.
Virginia Lester.
Yes, I'm the fire commissioner, oh my goodness, chair. And did we call the meeting to order yet?
Not yet. We've been recording since the beginning, but go ahead and call it. We'll continue introductions.
Oh, okay. Well, I'll call it to order 1614 on Wednesday the 8th.
Okay, we have 3 more people, Virginia, if we can pause just a second. Chris Patterson.
Sure.
Just an interested resident, been here for about 19 years.
Thank you for joining us, Chris, during this time and having to conduct meetings this way. Appreciate it. Nolan Gallagher.
Thanks.
Hi, everybody. I'm a probationary firefighter at the Point Roberts Fire Hall. Thanks for having me.
Okay, then we have a number 360-941-0912. You're the last person.
Don Schwalbach, part of the Wetlands Protection Program. Just kidding.
Thanks for being here, Don. Appreciate your time today. Okay, so if you could all mute yourselves at the beginning of the meeting. And Virginia, you have the meeting agenda.
I do.
Okay, go ahead. Thank you so much, Virginia, for being patient with all the introductions for the record.
Sure, thanks to everybody who has joined us today. I think this is really a very good mechanism for allowing people to sit in. I would like to make a comment at the very beginning. Christopher Carlton, you have given so much of your life and so many hours to making us all feel safe and cared for, and I just think that we all owe you a huge debt of gratitude for all that you're doing for us. So, thank you.
Thank you very much. Appreciate that. This community is extremely important to all of us, so thank you. We'll keep doing our job.
Okay. Well, any public comments at this time? Anybody want to ask any questions?
Can I bring something up I'm a little concerned about, actually, that happened to me yesterday?
Sure.
So I went to go buy eggs from somebody here in town because I didn't want to go to the store, and I've been super diligent and been at my house and disappeared for a couple months because I was already paranoid about everything for a while. And I go to this person's house, she gives me the eggs, I'm 6 feet away, and tells me she's a medical professional and around COVID positive people. And she's selling eggs here on the point, and I just don't even know how to deal with this now because it's kind of upsetting me a little bit.
Sure.
So I just thought I don't know, is this okay? Is this not okay? Like, I just think she kind of was downplaying the whole thing. I was a little concerned about that. So I just thought I should say something. I don't even know. I don't want to get her in trouble, but I don't really know. I had to ask her today because I'm immune compromised, so is my son Bodie. I have asthma, so I have to be very, very careful. So I just am concerned about somebody who's selling food and having people come to their house if she's around these people that are positive. I just don't even know if is this fine? I don't know. She told me she was today tested negative last week, but it could still take another, week or so for that to show up, right?
Sure. So I'd like to give that question to our nurse practitioner. So Virginia, do you want to?
Thank you.
Well, I will attempt to answer it. I would suggest that you make sure that you are wearing protective gear and that the person who is bringing you the items as well. If she's tested positive, she's tested negative and has had no positive signs of any of the illness, I would hope that she is wearing a mask and gloves when she's handing you the eggs. I don't know how you decontaminate the eggs, except I have heard people say they wipe them off with wipes. But I don't think there's any real answer to all of your questions. Chief, you have something else to add?
No, I mean the eggs are obviously covered in a shell. So wiping off the shell, I would say you can do anything to the shell, as in cleaning it and then run it underneath regular water. But other than that, obviously it's not the right thing for her to be doing if she's around COVID and she's selling eggs. But I don't know if we can do anything to stop her from providing those eggs to people.
I just wish she had informed me to make a decision prior. I could tell her that. I kind of texted her today that it would be, because then I could have made a decision. Okay, I'm not going to go over there.
Right.
Yeah.
Yeah.
So yeah, that was kind of my thing. But okay, thank you.
Understand.
Sure. Anybody else? If not, I think we'll go to the minutes. I would ask the commissioners if there are any corrections or additions to the minutes as printed.
I have none.
Okay, hearing none, we'll accept them as written. The next item is the financial report. Patty, are you available online?
Yes.
Okay, thank you.
Yes. So today we have April warrants that total $18,219.57. The total for payroll is $22,167.83. That includes Chief Carlton's salary of $5,278.50 and Chief Shields' pay of $3,083.33. And there was one event for each of the commissioners and the secretary. The total payout for the volunteers, warrants included, is $14,424. And I believe you all have the March financial statements for review to the commissioners. So today we're just looking for a motion to approve the warrants and payroll for April as presented.
Thank you, Patty. I would entertain a motion to accept the financial report.
I move that the claims request for $18,219.57 and payroll expenses of $22,167.83 be approved.
And all in favor?
Pat, go ahead, Pat Harper.
Aye.
Pat Harper approves.
Sarah Oggle, aye.
They've all passed. Okay, next on the agenda is, I'm sorry, Patty.
Sorry, I was muted. I also need to request to void warrant 1105263 by motion of the board. It was payable to MCI Whatcom with the March payables. The amount was listed as incorrect, and it has since been corrected and added to the April payables.
And do we need a motion for that?
Yes, please. Just a motion to void.
And a motion for that to be paid.
I move that warrant correction be approved and paid.
You have a second?
Commissioner Harper.
Okay, it passes then, thank you. Next item of business, you have something else, Patty?
Yes, just one quick, just a budget update. As of March 31st, 2020, we currently have 76.85% remaining in the budget compared to 78.64% in March of 2019.
Okay, any questions about that? Do the commissioners need to ask Patty any questions about the financial report?
Give me 1 second. Commissioner Harper, can you take us off speaker, because it's really difficult to hear you?
Okay.
So if you can speak regularly through the phone, that would be great. 1 second, please, for Commissioner Harper.
Okay, can you hear me now?
Yeah.
Okay, I've heard no other questions.
Commissioner Harper has no questions.
Okay, then that's the final issue on the financial report. Patty, is there anything else?
No, that concludes.
Thank you so much.
Thank
I know
you.
this is a little cumbersome, but we'll get through it.
Absolutely.
Okay. Chief, any correspondence?
We've had a lot of emails, a lot of thank you emails as well from community members during the COVID response. And everybody's has access to the community letters that I'm providing on PAWS, Point Interface, also sending to the All Point Bulletin and Nextdoor. So if you have any questions on anything that I'm publishing during those community letters during the COVID incident, please let me know. You can email me or call me.
Good, thank you. You want to?
I have a comment to make.
Sure.
I would like to applaud Chief Carlton on his community outreach efforts and his very successful attempts at keeping this community informed. I think that your letters to the community are excellent, and I appreciate your doing that.
No, thank you very much. I also need to extend a huge round of applause to Pat Grubb with the All Point Bulletin, because they've been publishing a lot of wonderful things too. They've also been putting my newsletters out there and my letters to Whatcom County Council. So I would like to say thanks to Pat Grubb during this process, but thank you.
And I think all of the commissioners would support you in that. It's been very helpful to have good communication for everyone. Okay, your chief's report.
So my chief report for April 2020 for the month of March 2020. Grants, we got denied on the Firehouse Subs grant. That was for 9 sets of bunker gear. So I'm going to be doing that again. Another quarter for that agency has opened up for grant process. I think it was so close to us getting the last grant. It had been just at 2 years getting the last grant, and they only give grants every 2 years. So I think that's one of the reasons why we didn't receive this last one. But it's worth about $25,000. So just to let the public know, to outfit 9 firefighters just with the bunker gear that we have, the coats, the pants, the boots, and the helmets, it's right at $25,000 to do that. We're still transitioning. We're still transitioning to the new website and interface, and that's continuing. It's slowed down a little bit just because of the national emergency with COVID that we're currently in at this time, but hopefully I'm optimistic that we can have that up and running hopefully by the 1st of May, if not sooner, and our website will change. It'll be a different look, refreshed for the public. I have no reports to give on any of the apparatus at this time. We currently have a roster of 42 members, 24 Canadian, 10 Point Roberts, 8 county. Within that 42 membership, we have 5 paramedics, 8 EMTs, of which 5 are advanced EMTs. We have 3 ambassadors, and we have 34 firefighters on staff. Volunteer hours for the month of March were 2,344 given to this community. Volunteer payroll, 14,714 if all of my volunteers were getting paid. Combined chief hours, I worked 160 hours last month. I did try to go on vacation down to Cabo. That didn't really work out that much. I was in meetings the majority of those days, but I guess it was okay because I was overlooking the beach in the Pacific Ocean, so it was a nice place to be in the meetings. And then Chief Shields had 136.5 hours to this community for a total of chief hours 296.5. We had 20 calls last month, the month of March. We had 9 EMS calls. We had 3 transports to St. Joseph's Hospital. We had 1 transport to Airlift Northwest. We had 4 no transports or patient refusals, and North Whatcom Fire Rescue took one of our patients down to St. Joseph's Hospital. We had 4 community paramedic contacts last month. We had 1 law enforcement assist, and we had 1 public service. We had 5 classifications of fire. We had 1 illegal burn, 1 permitted burn. We had a false alarm to a residential structure. We had 1 incident with power lines down, and we had a gas leak. And that concludes my chief's report for the month of March, unless there's any questions.
Chief, I would like to make a comment about the time that you spent on your vacation. I think that we might be able to, in the future, see that you get some time off, and that would be at your discretion.
Well, I appreciate that. I knew that it was probably going to happen when I went down, but it was a good it was a good time away for all of us, my wife and some of our friends, and we still had a good time. But I was in meetings the majority of during Monday through Friday while I was down there. So the COVID thing took off and Unified Command got established, and everybody's been working really hard for Whatcom County trying to keep us all safe.
Well, I think a big thank you for all of that time spent. One other comment, the community people that we, through the CARES program, I have been making phone calls to them instead of visiting them, and I don't know if you can add that to the roster or not.
Okay, will do. I'll talk to you about that after the meeting.
Okay, that would be great. That's the end of your report?
That is the end of my report unless there's any questions.
No questions? Unfinished business. Does anyone have any unfinished business that they would like to bring up?
I have a question. Again, that's Heather. I'm just curious, and maybe you've discussed this already, probably I'm assuming, but I know if people start getting sick here in Point Roberts, which may happen, obviously it's everywhere at this point. I heard the plan was mainly to airlift people now back into the mainland. So I was curious, are we gonna be set up here with like stuff here on the point at all? Is there a way to do that if we needed to have it here for any reason? I'm just curious about that.
I'll let the chief give you the answer to that question.
Sure, so I was going to go in that under new business, but I'll go ahead and hit it now. So that's okay, that's all right. So the recommendation, and we try to recommend it all the time for people to have either cross-border insurance that covers air transport, or to become members of Airlift Northwest. You can also become members of Life Flight, but that's on the south side of Seattle. So it would take a lot longer for them to get here. Airlift is based out of Bellingham, and then their second helicopter comes out of Anacortes, Arlington?
Yep.
Anacortes, Arlington. Linda, there's a couple more people here that I need to make sure you get on the list. Chief Shields is here in the room. We have...
Balloon Navarro.
Say your names.
Oh, Chris Balloon.
Chris Balloon.
Sebastian Navarro. Kyle Bilton.
Kyle Bilton and Sebastian Navarro. They're three members of the organization that are sitting in on this meeting. I guess I can show you, so you guys are there, right there. So everybody, and Chief Shields is right there. So just to get that on record, I guess. Okay, back to Airlift Northwest. We use them, right now we're using them in components to helping us transport patients to the hospital, because it usually takes us about an hour, hour and 15, hour and a half. Right now it'll probably be right around an hour to an hour and 15, because the borders are not overused at this point. We don't have a lot of traffic. And it helps us decrease the amount of time we're in front of somebody in a closed space in the back of an ambulance. That's one of the longest transports here in Whatcom County. And if we do have somebody that's presumptive or that tells us they are COVID positive through a test with Whatcom County Health Department, then we would want to minimize our time in a closed ambulance with them. So we're using Airlift more for that. Now Airlift's come up to the point over the last couple weeks. You've probably seen them come in, heard them fly in, but none of those patients, I have no information that we have any COVID positive patients here in Point Roberts at this time. So, and I'll just put that out there. I have no information about that. We have people that say that they, subjectively, they say they had it, they recovered, but we just don't know if that's the regular flu or a bad cold. We'll continue through the process here. So I would hope that everybody would have some type of insurance. You have to have underlining insurance. So Medicaid, if you're on state insurance with AppleCare, that's fully covered for flights. You don't need to have Airlift Northwest. The Medicare and a supplemental will cover it, but they also recommend beyond that. And it's only $60 for your entire household for a whole year. So that's anybody living underneath your roof, your dependents, your partners, your husband, your wife. whatever be the case. And I think most people can afford that for $60. It covers you everywhere in Washington and also Southeast Alaska. So if they used to have reciprocal agreements with other flight services, but they canceled all of those because of new regulations, I guess. So if Life Flight would transport you, Life Flight would have honored, in the past, would have honored the agreement or contract you had with Airlift and treated it as the same, but they don't do that anymore. So realistically, I'm a member of Airlift. Just because I'm emergency medical services doesn't mean I get free rides. So I have to be a member for my family, for me and my wife. And then I'll probably also join Life Flight, which is another, I think it's $60 too. I haven't checked into that. So if I am down on the Bremerton area, down south of Seattle somewhere, where they're the primary helicopter transport, then I would be covered underneath them too. So now you're really having to become part of any service that's available that you might have to use in the future. But most insurances, I would say, have within, a lot of us don't know about our insurances. I mean, that's just the way of the world. But most insurances do have helicopter transport coverage. It's just to what degree. Pat Grubb sent me a side note on our last meeting and explained it really well in regards to that. Pat, can you come on and explain what you explained to me last meeting?
It's just how Airlift Northwest is secondary. It's your main insurance company that they send the bill to, and then what is the patient portion of it is what they will cover. And I can find that and send it to everyone that's on this Zoom meeting.
Okay, thank you very much. I appreciate that. What else can I tell you, Heather? Did that answer some of your question, or all of it? Or
Pretty much. I was just concerned, like, if God forbid anything like this happens and there's people sick here or whatever, I was just erring on the side of caution, I guess. But I'm thinking, like, would we even be set up here at all to have beds for anybody here, or do we just, like, get them out of here as soon as possible? Like, how does if the worst case scenario happens, I'm just curious what we would do here. Like, can we set anything up at the fire station parking lot? Do we have anything like that in case we need to do that?
Great.
I'm just curious.
Yeah, thank you for that question. That's a great question. So we do have agreements right now. Right now, their Unified Command is working on a contract with a whale sightseeing vessel that would be used if the border completely shut. And right now, it's not needed. But we want to definitely have that under contract if we need to have a ferry back and forth from Point Roberts to Blaine. The other thing I had to ask was, well, we can get people to Blaine, but what do they do from the dock? So are the taxis still up and running? How are they going to get around if nobody's able to drive them? So that's something Unified Command is looking in at, is whether or not the taxis are available, whether Uber's available, or we could get our Circle of Care truck down to the county and possibly transport people around then, trying to maintain the social distancing that's necessary on a bus, because we need to still try to do that in general. So we have two large structures here and land that the owners have been contacted in regards to using their facilities that are wide open on the insides if we needed to set up beds, cots, gurneys, those types of things. And the perception that we don't transport everybody, especially during this emergency. Our guidance as a paramedic, if I show up on scene, we're not going to automatically transport you to the hospital if you're showing signs of COVID. We will actually call medical control if necessary at the hospital and get their direction. But we'd rather you try to isolate at home, and we have sheets that we'll give you that gives you some guidance. And then we'll do our best to support your needs during that period of time by bringing you the food and everything else you need so you can succeed at that self-isolation. But I'm happy to sit on somebody's porch with them Obviously, I'll be all decked out in my protective equipment, but there's a lot of loneliness when it comes to self-isolation, and I think everybody understands that during this time frame. And I don't want anybody that would be presumptive or COVID positive in this community to be alone during that period of time. So that would be an outreach we would start. If we have a massive amount of people here that end up start getting sick, those types of things, then we would have to upgrade our actions here through unified command and start setting up those structures that we have by graces of the owners and the lands that they have. RV, Best Time RV has reached out. We have them with unified command as well. And I think one of the best ways to isolate people, because right now they don't have anywhere for people such as myself, first responders, to go. If we come down with COVID or presumptive, they tell us to go home and isolate at home. Well, that's kind of not okay, because now I'm isolating with my wife, and that could infect her or other firefighters that have children, all of those types of things. So we really don't have a plan for that. They just tell us to go home and isolate. Some firefighters have, RVs or third wheels, fifth wheels that are outside their homes, and they're staying in those through this entire event, away from their families, just because we're in front of this virus almost daily when we're responding, definitely down in the county. So the RVs, if we have to isolate a whole bunch of people, Best Time RV has offered that. So I think that's one of the best ways to keep people separated versus putting them inside of a building, with cots separated 6 feet apart. But giving them their own RV, which the restroom facilities in those RVs can be dumped from the outside. So that would be protected for the person that would have to do that. And that's where we're at. So yes, we do have that plan. It's in contingency right now. And if I need to implement those things, then we'll move forwards with that.
That's great, thank you so much. And I wanted to also mention, because I just was on a conference call with Airbnb about some stuff, since I have my unit here, but they're trying to get, and might be another option depending on what happens, but they're trying to do something now for first responders and Airbnb to offer either like a discount rate or free for people to offer their places. So I don't know if anybody here running their Airbnb would be interested in that too, but that might be another option for first responders who need a place, if they need a place to go.
Great, wonderful, thank you.
Yeah. Okay. Cool.
Any other questions?
I don't know, but Chief, I would add some of the description of the other work you're doing. If the border should shut down, what's being done to facilitate supplies, etc. here.
Okay, so other contingencies that we have, not only the sightseeing whaling vessel, but we also have plans for helicopter deliveries and or fixed wing coming into the airport. We've already practiced that, I believe, with the National Guard. Was it the National?
2 years ago?
National Guard?
Yep,
Who?
Yes, it was National Guard.
We believe it was the National Guard. 2 years ago, they brought up Black Hawk, but it was through, I think, during Cascadia Rising, and they hopped all over the islands around here and then made it up to Point Roberts and gave us boxes that weren't filled with anything, but just to say, okay, these are the supplies we're giving you. So we do have all of that on the table, and I want to make sure that the public here feels very comfortable with that. If the border completely closes, obviously emergency services are still going to be allowed through, because if we don't have a helicopter or a boat available, then the perspective of that is we have to go by ground to get somebody to the hospital. So I don't think we'll be barred from entering Canada at any point. And if we need to help pick up medicines down south, anything like that, then I'll send a vehicle down. We'll make those runs, we'll pick up those medicines, we'll help Circle of Care because they've been doing a lot of that within this community. And we'll get it done. We'll do what needs to be done so we all get through this as good as possible.
Good, thank you. Christopher, I have a question about Airlift Northwest. If they were transporting someone and there was an additional problem that someone else needed to be transported, would any of those other aircraft entities be available to us?
Yes, they would. So if I had to request a second helicopter, Airlift would pull from their next closest location. and they would send that helicopter. If they notice that both helicopters are out north of Seattle, then they'll move up the southern helicopter and they'll position it more centrally. And that's it built in their plan for response. Life flight, I can definitely request life flight as well. And then we also have the Navy. The Navy will come out of Whidbey Islands, and they'll bring a Black Hawk and a paramedic if necessary to come here. But their response time is normally around 45 minutes if they're on the tarmac at the time we make that call. And that service is free because we pay for it through our taxes. So, and you get a ride on a Black Hawk. That's kind of fun.
Anything else from new business? Jump into.
Sure, I'll go ahead on new business, and I'll just put this out there to the public and all of you that are there. We received 100 COVID-19 tests at the fire department, and those are going to be. We're going to be conducting tests most likely this Saturday. I'm going to be sending out an email to the community, and we're going to be doing subsections or try to get a cross section of the community in different age ranges. And that's between 20 and 30, 30 and 40, 40, 50, and so on. In a previous meeting, I got pointed out I need to include those that are above 80. So we have to probably go 80 to 81. No. So probably 80 to 85. And have that as a group as well. And I'm going to be testing the essential providers. And what I mean by that, I think the people who have been keeping the grocery store open, our fuel stations open, working the community center, our food bank personnel. And I got really good direction and advice from another meeting that I had today and the participants within that meeting. And making sure that those people are tested since they're on the front line for us right now, and that includes circle of care and so forth. So I'll be getting those people through, and then I'll be opening up to people, probably 10 people in each age range, the 10-year age range, like 20 to 30. I'll probably be doing 10 people within that group range. One person per household was another big important point for people to understand. I'm not going to test 4 people that live in the same household. That if one of them comes back positive, then I would test the others because they're co-inhabitants. But I'm hoping to get 60 to 70 people tested on Saturday, and that would be this Saturday, most likely starting at 10 o'clock. Again, I'm going to be sending out an email, and we'll be reaching out specifically to the businesses that have stayed open for the essential services here in Point Roberts. I'll be doing them separately this testing. But I'll tell you this, it's not a comfortable test. So if you want to be one of these people, we have a swab that goes into your nose all the way back to the end of your turbinate back here, and then we have to stick it all the way back, and we have to move it around a little bit to get a good sample, and then we pull it out. So I guess something that could happen would be a nosebleed, and if you're on blood thinners, that might not be a positive thing for you to necessarily take a test. People who have recently come back to Point Roberts is another group that I'll be asking that maybe comes and gets tested, that just returned from maybe Arizona or other places and are in their first week of isolation, but offering it to them as well. Anybody that's asymptomatic that has been in their home for 3 weeks, it's very unlikely that you have the COVID virus, and those people would probably be pushed down the list and not be on a high degree of testing for this first go. Now, if we do start having people pop up here that are COVID positive after this round of tests, I should have the results back on Monday. So if we do it on Saturday, we'll take them down Sunday morning, and the lab has a 24-hour turnaround, is what they're saying. And then those test results will be sent to our supervising physician here, Dr. McBain, for Whatcom County Fire District 5. And him and I will discuss the results at that point and contact anybody along with the Whatcom County Health Department that would end up coming back with a positive COVID. One thing I need to express is that these tests, the current test we have right now is 20 to 40%. They're wrong. I'll just say that. They give false negatives. So 20 to 40% of the time. So that means 60 to 80% of the time they'll be on, but 20 to 40% of the time they'll give a false negative and the person is still COVID positive. And it's the best test we currently have. I'm hoping that a newer test comes out. I understand they have a 15-minute test now that can come out that's more point of care type of testing. You don't have to send that off necessarily. But I hope that we get that type of test here some point in the future. For now, we have 100 exams, and I plan on doing the cross-section again to the community. And if we get like, let's say I test 10, 20 to 30-year-olds, and 7 of them come back positive, then obviously I'm going to expand the testing for that age group within our community. If I test 50 to 60-year-olds, and one of them comes back positive, then there may be a little more testing within that subgroup on the next round of tests, but it wouldn't be expanded that much, I don't think, unless I start getting a lot of hits in that area of age range. Okay, so I just want to let you guys know, since you're on the meeting today, that we have the exams for this community. Saturday we'll start producing those and inviting people to come in. I'll be sending out an email to the community, and there'll be different times for different people, but most likely those that will be invited will be first come, first served in those age groups, and I'll be sending back emails to those that have been accepted to come in the first round of testing. Does anybody have any questions on that?
Actually, I have a question real quick, sorry.
I have a question.
Go ahead.
Okay, go ahead, Yolanda.
Thank you. So if someone comes back positive from the market, this is where I'm most concerned because that's the only place I'm going.
Sure.
Are we going to, but we don't, of course, have to know who, but if somebody is positive there, the people that are going shopping from the household, would they be more than likely the ones that need to be tested because they have been in contact with the employees at the market?
Sure. Whatcom County Health Department, if we do have somebody that comes back positive, Whatcom County Health Department is going to be the lead agency that reaches out to that person and talks to them about all their contacts and their close contacts. So if somebody came back from the market as an employee, then the whole market would be tested. All of their employees would be tested at that point to see where they're at. And hopefully none of the other employees come back COVID positive. But then they would have to track where that person has been, how many people they have come in contact with. And they would put that out most likely to the public, that if you've been to the market during this time frame and come in contact with this particular person, then they would request that you would come in for testing.
Okay, thank you very much.
You're welcome. Go ahead, Heather.
I was just curious about what about the people that are still allowed to go back into the mainland U.S. to work and come back, or back into Canada and come back, like into Vancouver? I've been a little concerned about that. I don't know what it's like right now and like down in Washington, like Bellingham area. I haven't really looked into that again recently, but I don't know if there's more potential for exposure over there. So would those be good candidates?
I think so. Whether or not they get done in this first round will be the question. And it's so hard when you have 1,400 people to try to figure out who should have the testing up front. I think the older population within our community definitely has priority because they're the highest group that's dying with this disease. And I'll do my best. That's what I can tell all of you today, is I'll do my best that if I run out of exams, then I'll order more exams. If we start getting a lot of hits here in Point Roberts about people that are coming up positive, then obviously we'll have to ramp up the testing, and I'll have to reach out to Whatcom County Health Department for that assistance.
Thank you.
You're welcome.
Any more questions?
Is this for general conversation or that later?
Now, you can go ahead.
Anything general. I was wondering if anything new could be said about the border and, for instance, if someone had to go to a dentist or something like that, is there a special procedure for this? If you need to go, well, just for anything actually, if you're going to go, even to go into Canada for a dentist, for instance.
Sure, I'll answer that. I'm on the cross-border task force, and CBP and CBSA are 99% on those meetings when we have them. And we have them on Tuesdays and Thursdays, or Tuesdays and Fridays, excuse me. And CBSA has become a little bit more, they're really trying to look at people crossing the border and looking at their reason to be crossing into Canada, especially if they're going to go into Canada for shopping purposes and then come back. What don't they have here in Point Roberts that they need to get in Canada? They've used an example like if you normally use Tide and the marketplace has run out of Tide, they're not likely to let you through to go buy Tide. That if there's other laundry detergents at the marketplace, you probably will have to switch for the time being. That would not be considered part of essential travel. Going to the dentist, absolutely, that's a doctor's appointment, and I don't see any reason, no one has ever said on these meetings from CBP or CBSA that they wouldn't let you go through for prescriptions or for a doctor's appointment, and that includes dentistry. So if you are having a dental problem, then that incorporates into having difficulty eating and everything else. So that should be allowed. I don't see any guff. Now,
So are you saying that it's free travel, or there are requirements to a paper trail, and they want to know who you are?
Oh yeah.
They want your name.
Even me now, I'm in a marked vehicle, so I'm in the white Tahoe, and they asked for my telephone number, my email address. They asked me where I was going, and even though I'm in a marked vehicle, I'm emergency service, I'm part of that essential services group. They're still, wanting to know where I'm going as well, so I'm part of this. I even get secondary in the vehicle, and they should do that. I mean, they're doing their job regardless that I'm in a marked vehicle. I'm still somebody, and they should secondary me, so they go through my vehicle just like everybody else. But I say it's, as long as you have a valid reason to go to the other side, I would say go to the other side versus go into Canada for something, unless your doctor is in Canada. Like my wife is Canadian, she's a US citizen and Canadian, so now she's dual, but her doctor is in Canada. Dual citizens kind of have a special permission during this process because neither country can deny you entry as a citizen. Now, they are told they are supposed to self-quarantine for 14 days, but she can come back through since she's a US citizen now, and the US border has to let her in as a citizen. So that's kind of I know we have some dual citizens here that are going back and forth on a daily basis, and that is causing, the border to start looking at different people, I think, a little heavier, and confirming truly why they need to go into Canada. But we had a person that published on Nextdoor the other day to a comment or to my letter, and he felt like he was going to be denied to go down to the main part of the county in order to get his cane fixed, to get some eyeglasses fixed, and to go get a prescription. But he wasn't in the end. They did ask questions regarding why he needed to go, and he was let through. So I haven't heard of anybody being blocked yet, although I was on the Blaine, one of my members was on the Blaine side coming through at Peace Arch, and there was a gentleman in front of him that got turned around. So I don't know what that circumstance was, but it was someone who was trying to go into Canada from the United States down at Peace Arch, and they didn't allow him in due to the reasonings that he wanted. So right now, I'd say if you have a valid reason to go. Don't be afraid of the border. They're just doing a job. They're trying to protect. They really want to know why people are coming through. As I say in my community newsletters, that it's always a privilege to go into another sovereign country. And even though we're in our geographical position, it's still something we need to consider and a privilege every time we come back, every time we go back and forth. And I understand frustration for some people, some fear that we're landlocked right now, but I don't have any of that information coming from CBSA that travel is being blocked. That is essential.
Great, thank you.
You're welcome.
Any other questions? Any other business?
Can I just, sorry, I couldn't find my unmute button there quick enough. I'm just wondering, I've read from CDC and also Whatcom County that they're now recommending that we wear masks whenever we're out in public, but there's people here who don't want to abide by that because they don't feel we're in a hot file.
But it's not a mandatory. It's not mandatory to wear masks. It's a recommendation for people to wear masks. Hopefully you'll see all of my members when they're in a public building. I did a chief's directive a few days ago. They'll always be wearing masks when they go into a public building, regardless. So if they're at the grocery store, they're going to look like Bane from Batman, because that's the masks that we have currently. But the average public, it's their choice. It's not a mandate at this time.
Thank you.
Virginia, do you have anything to add to that?
No, I think people have to be comfortable with what they're doing. If they feel comfortable having a mask on, go ahead and do it. If you don't feel you need it, and you want to keep your distance from everyone and protect yourself as best you can, that I think is okay now too. And unless they make it mandatory, we can't really do that either. Anything else? Any other questions? This is your good time to ask the chief questions.
All right, one more.
Heather? Okay, Heather.
So,
That's okay.
Did you guys have enough, then, if we need more equipment, we have enough funding from the government for this stuff, or do we need to start worrying about that too? Do we need to be raising more money and funds right now? Are we okay?
No, I need to go back to Mexico.
Yep.
But no, we're perfectly fine. And there is no reason to be in fear that we're running out of money. The issue is finding supplies. Just like any agency hospitals, I mean, there's no masks available. There's no gowns available. So I made a mistake probably a year ago. My assistant chief's to my shoulder here. That he made fun of me for because I hit the wrong button when I ordered N95 masks about a year ago. And I ordered cases versus just a couple boxes, and he kind of made fun of me for that, but now he's not making fun of me anymore.
Oh, that's good.
Because we actually need them. But we're getting, if we need assistance, we can get supplies from Unified Command, who's buying in bulk from the state and federal government, and finding different supply chains than what I have. But we're still trying to do our own supply chains, and I just got a box of 10 gallons. That's all I could buy, because they've reduced the size of orders everybody can have. So all I was able to get in one order was 10 gallons. That's it. But everything's okay. We're doing just fine, and I want to thank the public and thank you for asking that question, but we're doing fine.
Okay, good. Okay. If you need help, let me know.
Thank you so much.
Thank you to everyone who came on, and I think at this point, I'll entertain a motion for adjournment.
I move that the meeting be adjourned.
Commissioner Harper seconded that.
Thank you. The meeting is adjourned at 17:02.
Great. Thanks everybody for coming today. We're going to be doing this during this period of time, and I really want to thank everybody for coming on today and participating in our meeting. This is the most people we've had
Ever.
for a long time. And it took a webinar to do it, but thank you all so much. Please be safe, stay safe. If you need anything, please reach out to me and we'll help you if we can.
And I'll be around to get the things
Is this
signed.
weekly?
No, this is once a month. It's the second Wednesday of every month is our commissioners meeting.
Nice.
4 o'clock.
Yeah, 4 o'clock. Okay, thanks so much everybody.